When you go to your eye doctor for your yearly checkup, why do they blow air into your eyes? You know what I mean. They put you on a machine, tell you to look into the red dot, and all of a sudden, a burst of air assaults your eye. Why do they do this? Well, that machine is a tonometer, and what they're doing is they're measuring intraocular pressure, or the fluid pressure inside your eye. It's an especially important aspect in the diagnosis of glaucoma, a fairly common eye condition that can damage the optic nerve and eventually cause blindness over a course of many years. Today, I'll be talking about its causes and about how it can be diagnosed. The colored part of your eye, or your iris, has an extension called a ciliary body which constantly produces fluid. This fluid, or aqueous humor, travels through your pupil and winds up in between your iris and cornea. There, it's drained by a spongy tissue called the trabecular meshwork. If it wasn't drained, if there was something wrong with your trabecular meshwork, intraocular pressure could build up and your eye and optic nerve could be damaged. That's precisely what glaucoma is, the buildup of fluid pressure in your eye which damages the optic nerve and can cause blindness. Let's distinguish between the two types of the disease, between open angle and closed angle glaucoma. When we talk about the angle in glaucoma, we're referring to the angle between the iris and cornea. This one, right here. In open angle glaucoma, this angle is normal. It's open and fluid has no trouble flowing into the anterior chamber. The trouble in open angle glaucoma is that the trabecular meshwork is blocked or has stopped functioning, so aqueous humor isn't being drained and pressure builds up in the anterior chamber. In closed angle glaucoma, this angle has been completely blocked as a result of the iris pressing against the cornea. Aqueous humor can't flow near the trabecular meshwork at all, building intraocular pressure. Okay, let's talk about diagnosis. When diagnosing glaucoma, optometrists complete a full eye exam, examining 5 factors before making a definite diagnosis. Let's go through them. I've already talked about the first step. No contact tonometry, or the air puff test. It gives a pretty good approximation of intraocular pressure, but it isn't as accurate as Goldmann applanation tonometry, in which a probe is used on the surface of your eye. If your optometrist notices something abnormal about the pressure reading, they can proceed with further tests. The next step is ophthalmoscopy, in which your optometrist dilates your pupil and examines the shape and color of your optic nerve for any damage or abnormalities. It's in this test that your optometrist may measure your cup-to-disc ratio. Take a look at this photo taken during ophthalmoscopy. You see this circle? That's the head of the optic nerve, which is also referred to as the optic disc. Now, that lighter spot in the middle is the optic cup, or a region in the nerve head where there's a gap of nerve cells. Let's compare the image with a cross-sectional view. Notice how in the second picture, where there's a more dramatic depression, a bigger gap in the head of the nerve, the optic cup is visibly larger. We conclude that a larger optic cup means a larger gap of optic nerve cells. That could indicate that some cells have died, maybe as a result of glaucoma. When we take the size of the optic cup and divide it by the size of the optic disc, we get our cup-to-disc ratio. Ideally, we'd want a smaller cup-to-disc ratio, as it would indicate higher numbers of living nerve fibers in the optic nerve head. While a high cup-to-disc ratio on its own is nowhere near enough to indicate a glaucoma diagnosis, it can be used to reinforce a diagnosis or assess progression of glaucoma. Our next step is perimetry, or the measurement of your field of view. Your optometrist will tell you to look directly forward while they wave a light around your periphery in order to build a map of your vision. In the early stages of glaucoma, the first thing to go is usually your peripheral vision, so if there's already some damage there, that's more supporting evidence for a glaucoma diagnosis. Then, your optometrist will apply a mirrored contact lens to your eye in order to examine the angle between your iris and cornea. This is called gonioscopy. If the angle is obstructed, that could mean closed angle glaucoma. Finally, in order to adjust intraocular pressure readings, the thickness of your cornea will be measured in a process called Perimetry. Super short and simple test. A probe is placed on your eye to measure corneal thickness. With all of these 5 factors in mind, your optometrist will be able to provide a definite diagnosis and start developing a treatment plan. Thanks for watching this introduction and overview for glaucoma. Next time, I'll talk more about measuring cup to disc ratio, and then we'll delve into treating glaucoma. Bye!